received their shots more than 6 months ago to be extra careful in their daily routine. This is after reports of some senior citizens acquiring severe COVID despite being fully vaccinated back in March and April.
We need to encourage yung mga bata pa rin at saka yung mga matatanda because in the real ground experience, maski ngayon meron pa rin tayong mga admissions ng mga COVID, no?
Metro Manila is now considered at low risk for COVID-19, but public health experts are asking government to immediately give a third dose to populations who were vaccinated in the first quarter of the year, as their vaccine protection supposedly could be waning. But how can government fast-track the vaccination program with only more than 27 million fully vaccinated? We discuss in this episode of The Chiefs. Welcome to The Chiefs. I'm Robbie Alampay. With us in Manila, Ami Pamintuan of the Philippine Star, and here in Mandaluyong, Ed Lingao of One News. Chiefs, good evening. Happy Monday.
Happy Halloween.
Monday.
Oo nga pala, no? Happy Halloween. Hirap pagka nasa trabaho ko, nakakalimutan mo eh.
Actually, nung bata tayo, walang ganyang Halloween.
Wala.
Basta araw ng patay.
Ami, ano ba nangyari? May nangyari ba today?
Wala namang mga tao ngayon, busy na sa paghahanda ng Pasko, no? Baka sakaling ma-extend daw yung mall hours saka yung curfew, iiksiyan in preparation for Christmas, di ba?
But you know, today is November 1, so that means you have exactly 2 weeks to go before the deadline for substitution.
Yan ang binabantayan natin, di ba? I mean, kanina meron din, parang nagkanya-kanya yung mga kandidato kanina. Si VP Lenny was in Bicol, di ba? Pagkatapos, I think, who was in Bohol ba or ano ba?
That was Pacquiao, was in Panglao.
Si
Beach
Mayor
territory.
Isko for the weekend, of course, nandun sa naka-uniform pa nga eh.
Oo. And then there was a presidential forum in the weekend. Baka hindi nyo napansin. Si Ping Lacson lang yata yung nandun sa forum na yun, di ba? But at least people are starting to get into this. And the good news also, speaking of elections, is that, well, good news and bad news. Kung hindi kayo nakaregister, bad news. Talagang wala nang extension. But the good news is, the COMELEC is saying they exceeded all the targets. So good turnout. We're expecting a good turnout. Hopefully, COVID permitting. But speaking of COVID, let's talk about the situation in the country right now. We begin tonight with COVID. We'll speak with Professors Guido David and Ranjit Rai of Octa Research. Good evening, Professor Rai and Professor David.
Good evening to everyone, and good evening to our televiewers.
Hi, sir. Hi, sirs.
Hi, Professor. I'll start with Professor David. What are the latest numbers? Of course, we're coming off a long weekend. We're expecting numbers to drop to be relatively low today, and certainly tomorrow, Tuesday, again, it's going to be low. Notwithstanding that, what are we expecting as we enter the final 2 months of the year?
Yes, Robbie. Actually, we are seeing lower numbers. So yung 7-day average natin ngayon, nasa 4,100 na lang. And in fact, tomorrow, it's possible na less than 3,000 cases tayo for the first time since a long while na makakakita tayo ng 2,000 plus cases sa buong bansa. Itong 7-day average na 4,100, it's the lowest since early March when we were just having the alpha and beta surge. So ano yung in-expect natin? If the trends continue, we hope na we'll get it down to mga 2,000 cases per day by end of November. If the trends continue. Kailangan syempre patuloy yung pagsunod sa mga minimum public health standards, and yung pag-vaccinate natin, sana hindi siya ma-disrupt at mapatuloy natin, yung ma-address natin yung vaccine hesitancy sa ibang regions, kasi nakita namin yan based sa survey ng tugon ng masa ng Octa Research na medyo mataas pa yung hesitancy sa mga other regions. Pero hopefully nga, Robbie, tuloy-tuloy yan. So we'll get it down to 2,000 cases. Baka maaaring bumaba pa to 1,000 by December. Possible lang yan kasi nakita natin yan sa Indonesia. Ngayon, less than 1,000 cases na lang sila. So yan yung gusto nating sundin. Yan yung kumbaga model na sinusundan natin.
Yung NCR, as you pointed out, we're hitting, I think, 80% vaccination now sa NCR. But I remember one story kanina sa big story, we were quoting you, we're also noting an uptick in death, in at least in the death rate. What do you attribute that to?
Well, actually, Robbie, yung the other day we had 423 deaths. Part of that is mga late reported deaths. Pero doon sa 416 lang sa NCR. So actually, mababa yung death rate natin sa NCR, bumababa pa. So not just vaccination, pero treatment is also improving. Especially when we talk to our doctors sa team, sinasabi nila talaga improving treatment. So yung deaths na yan, nangyayari sa mga provinces. I believe especially doon sa mga provinces na medyo mababa pa yung vaccine uptake nila, and that's why it's affecting the number of deaths.
Oh, 1,000, that's pretty low, huh? That's almost like in December last year, no? Na talagang bumaba ng gusto yung cases. Pero what should we watch out for? Professor Ray, or known as the doomsayer in the group.
Grabe ka naman.
I gladly accept that moniker, that position in our group. And in fact, we had a discussion last night, and I've always reiterated in our group that we should be the voice of vigilance, sobriety. That our data, while we have scientific data to prove that the downward trend is real. Sustaining that trend requires all of us to be vigilant, requires all of us to focus on enforcing and practicing minimum public health standards, the wearing of face masks, if possible face shields in indoor spaces, and trying to avoid generally crowds and enclosed spaces. Especially for the unvaccinated, that would include our kids, would include some of our elderly who have remained unvaccinated. The reality is, trends can change. There is, while it's the probability is low, the possibility is always there that we could have a Christmas surge, like as experienced by many countries around the world. Last year we were able to dodge that bullet, largely because government and private sector, our communities were warned early that if we are complacent, if we do things irresponsibly, we don't stick to the plan, and we don't do our roles, which is to keep ourselves safe. These trends can easily reverse and become a surge. So this is the reality of it. We need to sustain it. And to sustain it until early part of next year will require all of us working together.
What are the biggest areas of concern for you? For example, yung proposal for 100% capacity in PUBs, for example, or yung sa easing of restrictions on children. And ano yung particular areas of concern?
For me, the particular area of concern would really be children, honestly. Unless we have some level of certainty as far as the number of children vaccinated are concerned, until we have more children vaccinated, I'm skeptical about exposing them, to more risk. So it's very risky, really, at the moment. Delta is here to, in a sense, COVID is it's the move now. In terms of mindset, it's going to be endemic. We're going to have to live with it, and therefore the goal now is to ramp up to max vaccination, even with our children. But there is some hesitancy all around the country. Our Tugunang Masa survey of September 11 to 16 shows that while 61% of our population, adult population, are willing to get vaccinated, this is actually a decrease from our July Q2 survey, which had 66%. So there's a decrease. Number two, more people now are hesitant, at 22%. And of the adult population are hesitant to be vaccinated, and these minorities are seen in Luzon, out of NCR, of course, Visayas and Mindanao, and in social classes D and E. So this is an issue of awareness, of education, and of that 22%, 5% are clear. They don't want to get vaccinated because they know, they feel, they've heard that you will die because of the vaccine. So there's also misinformation that we're battling. So this is the reality. It's a challenge. The last mile, so to speak, of vaccinations are going to be done over the next 6 months, and they'll be outside of the National Capital Region. And this will be the game changer. If we can't get this done, our country will still be vulnerable to surges.
Professors, could I ask you to be a bit more specific as far as yung what could disrupt the trend, the downward trend? Kasi I have heard some arguments that it would probably be, if at all, a new variant. Pero what about, quite simply, yung downgrading alert levels? More people out in the streets, more people in public conveyances, more people in public areas, looser restrictions. Could that as well trigger a change in the downward trend?
Gids, you start.
Yeah, okay, because I think the Professor Randit and I have a slightly different viewpoint dito. In fact, we sometimes talk about this. I have a more optimistic outlook than Professor Randit. Sabi niya nga, the doomsday device. So, yung sa akin naman, what I think is yun nga, yung the variant is the main concern. Yes, possible na makakita tayo ng optics. And there are still regions na hindi pa masyadong tinamaan ng Delta variant. They will still be vulnerable to surges because of yun nga, yung experience nila sa Delta variant, and because hindi pa masyadong mataas yung vaccine uptake nila in some provinces. Kasi hindi pa naman kumalat all over the Philippines yung Delta variant. It's hit most of the major metropolitan areas, but not every place siguro. There are some places na, yun nga, na hindi pa tinamaan. But so kung hindi tayo careful, we could still spread the variant there. Yung sa Metro Manila naman, we're close to 100% coverage of the adult population. This will help a lot. We might still see upticks in cases if we're not careful, because may mga breakthrough infections, yung mga kids are unvaccinated, and that's why yung concern ni Professor Randit is mainly yung mga unvaccinated. And there's also another factor, yung waning efficacy. This could be a game changer in the sense na, if we're not careful, baka bigla nagkaroon ng waning. Kasi hindi to well established, yung data dito is not clear kung talagang 6 to 8 months ba, which brands are nagkakaroon ng waning. Kasi pwedeng baka kampante tayo, hindi pa naman magwa-wane to, tapos biglang nagwa-wane na pala. So yes, because of the uncertainty, this could be a contributor. Kasi nakita na natin yun in other countries na because of waning, nagkaroon ng spikes sa Israel, for example.
I was gonna ask that, buti nabanggit mo, because I was gonna ask if the data that you're getting and that you have access to, can you monitor that phenomenon, or at least that theory that baka mag-wane na? Because people are starting to count, di ba? Everybody's bringing out their vaccination cards. Teka, kailan nga ba yung huli kong...
Remember, 8 months na since the first vaccination in March 1.
Di ba?
And these are healthcare workers who are
those
more
are the
exposed
frontliners
to
in
COVID-19.
particular, di ba? But are you able to monitor that people who do you have good enough data where you can disaggregate this rolling concern for people as they hit the 6-month mark and so on?
At this time, we don't have the data. We'll try to get it sa mga hospitals siguro, kasi mostly mga frontliners yung mga naunang nabakunahan, and then yung mga seniors. It's possible na baka nagwa-wane na and hindi natin alam, because we're seeing good numbers right now, bumababa yung cases. Kaya hindi pa natin natetest talaga yung theory na yan. This is still theoretical. So makikita talaga natin yun when the numbers coincide with what we are expecting. So, pero minsan maganda rin, unahan na natin. Hindi na natin kailangang hintayin na mag-wane siya in theory. Pwedeng, yun nga, bigay na natin yung booster sa mga seniors at sa mga frontliners.
Pero Prof. Guido, like I told you the other program, di ba? Parang naghahabulan tayo eh. On one hand, hinahabol natin na mabakunahan yung mga hindi pa natuturukan ni isang beses. On the other hand, kailangan natin habulin yung mga maaring nag-wane na yung kanilang bakuna na binigay nung March, April. So parang on two fronts kailangan mo maghabol.
Yeah. And this is the challenge, actually. The challenge here is how to deploy, optimize the deployment outside of the National Capital Region. And the big challenge now is, in the National Capital Region, we're more or less set. Most adults are actually vaccinated. So we won't have the kinds of surges we had early part of this year. We'll probably have some upticks. And mostly in those parts of the population, in the National Capital Region, they're unvaccinated children, maybe some of the elderly. But early part of next year, we're also projecting, before the elections, there might also be a surge. That's why we have been talking with our friends in government and the private sector. Maybe the strategic stockpile that we have should be now, slowly given out as boosters, especially to our frontliners, our elderly, and later on those who have comorbidities. Like, for example, I had my last vaccination was in May. So if this theory is true, then I might have waning, efficacy maybe early part of next year. But I also contracted COVID. So there are people who have natural immunity plus vaccination. That's a different story. So we're not seeing so much of a problem in the National Capital Region, in the NCR Plus, in Cebu, Metro Cebu, and Davao. But we're seeing this challenge more in places outside of those areas that were prioritized for vaccination. And that's why the key now is to roll out the vaccination more efficiently and continue with testing, tracing, and isolation in areas where optics evolve.
Professor, it's also a challenge in Metro Manila because we have the highest vaccination rate. Dito rin yung pinakamalakas yung pag-wane, di ba? Pinakamaraming tao yung nag-wane yung vaccination. And there's that possibility na baka nga maraming breakthrough and we will have another surge. Lalo na tatama siya, as you mentioned, by election day, by around election time. So
Possible.
I understand you are already discussing it with at least the private sector or the government. And is there any serious discussion on boosters na nga for those who might have waning vaccination?
Yeah, I think the government is very much aware of the challenge. And I think the priority is now with the healthcare workers. They're the people we need to prioritize, and the elderly. And I think we're going to probably follow the WHO guidelines here, where not all of the elderly, but those who are very old and sickly can be prioritized. The key is to get everybody vaccinated. I think that's the first step.
Yeah.
And we have enough supply by the end of the year for everyone. The next step is to get the children vaccinated so that we can start opening up for school, no?
Yeah.
And those are that will go in stages. My sense is government is aware of this. There's a robust discussion, but right now the priority is to open up in a safe and calibrated way our economy.
Yeah.
And that is now the focus of the IATF in our view. And they're doing that now in consultation with the private sector, with health experts. And in Okta, we're here to share our monitoring reports. And when we see upticks, we report as usual, not just to IATF, but also to the media, so that people may know.
Yeah, but Professor Rai, speaking of a more efficient rollout of vaccines, ano yung weak point or yung gap at this point? Kasi katulad na nasabi niya, nabanggit din niya kanina ni Dr. Lulu Bravo when I interviewed her sa Big Story, nabanggit niya rin na, by the end of the year, supply is not going to be the problem. So what is going to be the problem? Is it hesitancy? Is it logistics? Is it the supply chain, distribution? What is going to be the gap?
Well, hesitancy is going to be a big challenge. 22% of the adult population in the country, as said in our last survey, Q3 survey, that they will not have themselves vaccinated. That is a big challenge. We often overlook it, but that's going to be a big challenge, no? And we're seeing it among the poorest of the poor in our society, and in places like Visayas, in many places in Luzon, and in Mindanao. These are the places that have not experienced vaccines. And second, of course, is logistics. Many of our vaccines require some level of logistics capacity for local governments, in local governments, and we're having challenges there. And we have to roll out the vaccines quickly because they also have an expiration. So these are the multiple challenges. I'm sure, I'm certain, because there are more people who want to get vaccinated, and local governments need this as part of their milestone, and so that they can open up. These problems and bottlenecks will soon be resolved. But it will be a hard 6 months, no? Because this is it's easier to roll it out in NCR, but in other places in the country, it's going to be an incredible challenge, and those two elements are going to be the major stumbling blocks to
yung logistics,
optimizing.
yung logistics, I think everybody anticipated that, no? Not that we didn't anticipate hesitancy also, because we went through it, but precisely because we went through hesitancy here in NCR and all the urban centers. But as we pointed out, we're now at 80% in NCR. Kahit papano, we've overcome that. We have the experience. So what's driving hesitancy in areas outside of the urban centers, given that there's a treasure trove of experience and data and information from NCR in the urban centers at this point?
Well, based on the data that we have, that's the survey, the Tugunang Masa survey of September, our Q3 survey. 65% of those who have decided not to have themselves vaccinated cite the reason of safety as their basic reason for not getting vaccinated. 14% say they have issues about the effectiveness of the vaccine, no? Around 7%, and these are maybe the hardliners, no, who say that you don't need a vaccine for COVID-19. And a disturbing 5%, although it's a small number, of those who have decided not to have themselves vaccinated are not having themselves vaccinated largely because may nabalitaan silang namatay dahil sa vaccines. So yan yung mga rason kung bakit hindi nagpapabakuna yung 22% ng ating adult population. The number one reason is safety, efficacy, and misinformation to some extent.
On the other hand, in Metro Manila, there's also talk about vaccine overconfidence. Is this a real concern? Are you monitoring this?
This is really largely a product of a lack of information. Just because you're vaccinated doesn't mean you're Superman, no? And I think a lot of people are now better informed in the National Capital Region about the threat of Delta, the reality that there is the issue of breakthrough infections. We also included in our survey a preliminary question, no? Although we're going to build on this later on in the next quarter. Basic question was, how many of you have been completely vaccinated? We got the number. And how many of those completely vaccinated experienced COVID after being completely vaccinated? So 97% said no, they didn't experience any COVID after being completely vaccinated. But 3% of the adult of that number, okay, of adult Filipinos completely vaccinated experienced breakthrough. One could argue that vaccines work, no? 3% lang ang naka-experience ng COVID kahit na kompleto ang bakuna nila. But also 3% is a large number.
Yeah, that's 3 million or 4
it's something
million
worth
for the population.
reflecting on. And so we're going to build on this initial set of questions and study this more, the idea of breakthrough infections. And we're also going to study anong brands, no? Ang naka-experience ng breakthrough infection. Of course, the period is September 11 to 16. And, this was experienced largely in Balance Luzon. So, yeah, vaccines work. And I think the population that's not informed about it has to be informed. And that's the job of the Department of Health.
Professor Rai, balikan ko lang po yung binanggit nyo kanina, and tell me if I got this right. Parang you had some concerns and you talked about this na baka matsyempuhan yung surge doon sa bandang eleksyon. If not election season, at least sa first quarter ng 2022. What's the basis for this concern? Does it have to do with the cycle of the surges as you see it, or does it have to do with some other elements?
No, well, this is just a theoretical discussion we had with Father Austriaco and the group, no? That if indeed the theory is it lasts for 8 months to a year, we'll probably have the first batches, largely healthcare workers, who were the first to be vaccinated in March, probably experiencing waning efficacy first among others, no?
Yeah.
And that would be towards March, April, and the possibility that because they're waning efficacy of vaccines, they might be more vulnerable to whatever new variants that will likely evolve and spread. And this might be a possible source, no, of upticks and possibly surges in many parts of the country and even Metro Manila. So, which is why the argument about boosters is important. And who do we boost first? No, in our view, in Octa, we should provide boosters for our healthcare workers. We should provide boosters for that part of the population that is very vulnerable, the elderly.
Yeah, Professor David, in terms of geography, which regions stand out right now?
Regions in the Philippines. Well, right now, it's the general trend is downward naman in most areas in the Philippines. Yung mga may upticks lang ng cases, still Dumaguete, for example, although nagsa-start ng bumaba sa Dumaguete. Sa Occidental Mindoro, we're still seeing it, but in many other areas na nagkaroon ng late surge, like Zamboanga City, it's now actually decreasing. It's on a downward trend. Sa Northern Luzon, it's also on a downward trend. So actually, konti na lang talaga. That's why the overall case numbers have been decreasing. Ngayon, 4,100 na lang. That's actually a fairly decent number of cases for the entire country.
But very quickly, because we're running out of time, yung downward trend, this already factors in the loosening of the economy and the step down to alert level 3?
Yes, because that's what we're seeing. If we see an uptick due to the loosening of the economy, we should be seeing it. So far, we're not seeing a major uptick. Some LGUs have some slight upticks, but it's not clear if these were upticks or due to backlog of cases. Right now, the reproduction numbers healthy naman in the entire NCR. Every LGU is on a downward trend, and the hospital utilization is still healthy. The ADAR is still, in around moderate level for many LGUs. So we're not seeing any major cause for concern or any cause for concern at this time yet.
Okay, kasi Professor Rai, apart from, despite the downtrend here, the reality is, this is what we wanted. We wanted to reopen the economy, tourism is back, traffic, grabe kanina nung Friday heading into the long weekend. Kanina walang traffic because you could still actually sense na baka nasa ibang probinsya pa yung mga tao. I'm anticipating traffic ulit bukas. But are we still bracing for that? Notwithstanding all the encouraging numbers, are we still bracing for the full impact of this loosening of the economy, in particular domestic tourism as well?
Yeah, I think we have to monitor. As a group, we're always cautious. No, the argument of Octa for the last month and a half with the business sector is let's reopen, yes, but let's reopen safely. Let's do it in a calibrated, slow fashion, and let's all be mindful that our biggest challenge, apart from logistics, vaccine hesitation, poor deployment of our vaccines, is really complacency. At this point, there are a lot of people who are overestimating their achievements, no? Both government, the private sector, and communities, and underestimating this virus. And when that becomes predominant, surges happen. And so that's why we're always here in Octa trying to remind people that there's an anatomy to surges, and it starts really with people becoming complacent. And that's why we have to warn our citizens that while it's good that we're on a downward trend, we had an extremely vicious surge driven by Delta. Thousands died. But that should remind us that it's here, no? That the virus is still here, and we should continue to be vigilant. And if we want the good trends to continue, that we all have to do our part and work together to ensure, that these trends are sustained through the exercise, the enforcement of minimum public health standards, the ramping up of our vaccines, and of course the education of the remaining population who continue to be hesitant as far as vaccination is concerned.
Okay, Professors Ranjit Rai and Guido David of Octa Research. Maraming salamat po.
Ingat, sirs.
Maraming salamat.
Thank you. Good evening.
We will need to take a break. Please stay with us. The Chiefs will be right back.
Welcome back to the Chiefs here on One News. And now joining us is vaccine expert panel member Dr. Ron Jean Solante. He's also the head of the Adult Infectious Disease Unit of San Lazaro Hospital. Doc Ron Jean, maraming salamat for joining us and welcome back to the Chiefs.
Good evening, Doctor.
Good evening,
Hi,
sir.
good evening. Good evening to everyone.
Yes, sir. Doc, earlier you sounded the warning dun sa possible waning ng efficacy ng vaccines. Let me back it up a bit. What do we know and what should we know about how long yung efficacy ng mga bakunang ito? Kasi iba-ibang brand, baka iba-iba ang efficacy at iba-iba yung length ng efficacy.
Yeah, you're right, Ed, no? And when we start counting those maybe vulnerable at this point in time, are those who were vaccinated beginning March and April. And these are the healthcare workers. And on the ground, we do experience some of these healthcare workers having mild, moderate COVID since August and September. And we don't want that to happen, that to the point that we'll be seeing healthcare workers having severe infection, especially with the longer wait for the booster dose. 7 to 8 months after will be like November or December. So I hope this will be one of the priority of the government to give the booster to the healthcare workers.
Pero sir, parang ang hirap ng pagbabalanse ba? Dahil on one hand, kailangan mong bakunahan yung wala pang turok, hindi pa natuturukan ni isang beses. On the other hand, kailangan mong habulin yung mga nag-gawin na yung bakuna.
Yeah, correct. No? Pero at this point in time, there are already surplus of the vaccine supplies. And I think that ilan lang ba ang mga healthcare workers, no? And these are the frontliners who are really taking care of COVID. Allotment of vaccine should also be prioritized for these healthcare workers, because as we move forward and we'll have some of these mini surge of cases, November, December, hopefully it will not happen, then we're always at risk for these exposures.
Yeah, Dr. Solante, gaya ng sinabi nyo, may surplus. A lot of people have been saying that certainly by the end of the year, they're anticipating that supply will not be a problem. But when you talk of a surplus and stability in supply, that does not have any concern or any dilemmas when it comes to matching of vaccines. I mean, we have a surplus regardless of kung anong bakuna na nakuha mo at saka pwede mong gamitin for a third dose.
Thanks for that question, Robbie. There are already good data to indicate that whether this is a Sinovac as a third dose to those who are fully vaccinated with Sinovac, or an mRNA vaccine, or even a virus vector vaccine like Astra, this can be interchangeable in terms of protecting or eliciting protection. Okay. So that means that If we have limited supply, then we can accommodate and we can prioritize some of those supplies that are volume or high in volume, and more or less we can make it happen in terms of giving this to the health workers.
Ay, Dr. Solante, so we can keep that same mentality that the best vaccine is the one that's available? Yun pa rin
Correct.
ang mentality
Yeah.
I don't need to
Yeah.
be looking at any tables on which is best for which particular vaccine?
Correct. No, and if I'm going to really quote some of the other countries like the US, they already approved the mix and match for any of those three vaccines: the Janssen, the Pfizer, and the mRNA vaccine or the Moderna. All of these are interchangeable. They can be given to any individual, any of those vaccines. So probably that should also be our approach in terms of the vaccines, because all of the vaccines that are procured now can be interchanged in terms of being a booster to any of these vaccines.
Doktor, ang mga nagtatanong kasi, yung mga nag-receive ng Sinovac, I don't think they would mind getting an mRNA, no? Although kapareho ko, I have allergies, medyo mag-aalala ako mag-Pfizer from Sinovac. Ang mga nag-aalala, yung nakakuha ng mRNA, Moderna, Pfizer, and they will be given boosters daw or third doses na Sinovac. Is that a valid concern for them?
Yes, in fact, that can be part of the guideline when the Department of Health will release the guideline that there will be options regarding those third dose or booster, depending upon the experience of those who were able to get the primary vaccine series. So if you are concerned of the adverse reaction of the mRNA and you were able to receive Sinovac primary dose and it went well without the adverse reaction, then you can still get the third dose as preference if you want that.
Pero kung hindi preference, kung nandun na yon, hindi naman problema na, halimbawa, someone got Moderna, yung third dose nyo or booster, magiging Sinovac. It's not a problem actually. Scientifically, it's not a problem.
It's not a problem. It's not a problem as long as we will be receiving a third dose.
But we don't have a definitive policy yet sa third dose or boosters and mix and match brands. Wala pa.
Wala pa, no? I want to explain this, no, para lang maintindihan sa mga tao, no. The data on the booster shots are mainly based on immunogenicity. So ibig sabihin based on the antibody level, no. So merong iba doon na ang combination, like for example, if you are fully vaccinated with Sinovac and you get the third dose of an mRNA, nakitaan doon na mas mataas ang neutralizing antibody, no, compared to a third dose of a Sinovac. But again, these are immunogenicity. Nothing is superior in any of this, maski mataas yung antibody mo. Magkatalo lang yan kung merong data on outcome. Like for example, when you were given Sinovac and then Pfizer, third dose, mas maraming breakthrough infection doon sa third dose na binibigay in Sinovac, no? There's no such thing as data at this point in time. So we rely on the immunogenicity data, and for me, that can be there is no superior third dose compared for any of these vaccines.
Doc, so in the end, ano po yung timetable na tinitingnan natin for the third dose? Whether it's for those with comorbidities, senior citizens, or health workers. Kasi last I heard, ang inintay natin, number one, WHO recommendations, which we expect by November 15, I think. And number two, EUA ng FDA, which they also expect to release by a week or two. So baka by middle of this month, parehong mabigyan na yan.
Yes, Ed. No, and we're praying that can be realized now, middle of this month, November. So I think that's still good. It's still good, especially now that cases are still going down, or low number of cases. So the hospitals facilities are not handling much of these COVID cases. So there's time for the healthcare workers to rest, no, and more or less prepare for hopefully for the next surge.
Okay,
Hindi
sir, sa ngayon na hindi pa naman mandated yung third dose for everybody, what should people be doing nonetheless at home? I mean, would you basically recommend that everybody at least, look at your vaccine card, at least know kung kailan are we necessarily encouraging people to at least start counting 6 months from their second dose?
The recommendation for the general public, I would surmise, will follow after all of this priority population will be given the third dose or a booster dose. And just like what we did with the primary vaccine series, we prioritize those high risk and vulnerable.
Okay, so and then in practical terms, what do we then anticipate happening? So let's say, chinek ko ngayon yung vaccine card ko. Alam ko na kung kailan yung 6 months ko. In practical terms, I'm still going to go through the same process. I'm waiting for my LGU, for example, to announce it again na, o sige, pwede na kayong mag-appointment ulit. What are the things that need to happen before people can start saying, okay, I can actually do something about this? I'm aware of it, but the next question is, what can we actually do?
That's very important because as we approach the holidays like November and December, and those who are vaccinated early in March, April will be vulnerable, then they really have to be careful and they have to obey the protocols and as much as possible really observe the non-important gatherings that they should not attend.
Dr. At ngayon, even ordinary people are worried about the waning efficacy of the vaccines, no? Pero is there solid data on whether those who got natural immunity by getting COVID previously, is there solid data na mas mataas yung immunity nila together with the full vaccine dose?
Yes, correct, no? And in fact, may mga ibang bansa during the first quarter of this year na medyo kulang yung mga bakuna nila na they screened those who were previously infected and they only gave 1 dose instead of the 2 dose.
Okay. But can they afford to wait maybe up to a year? You mean natural immunity?
Okay, those with vaccinated and natural immunity, yes, they still have a very good antibody. Ang dapat lang hindi magiging complacent yung mga with previous infection and are not yet vaccinated, okay? Because their immunity, their protection also waned because of that natural infection.
Kung double immunity, longer yung yung less problems for us. Kasi nagkaroon na rin ako. Gaano katagal yon na longer than 6 months? How long?
The data is between 6 to 8 months, but we still encourage those na kung halimbawa, depende kasi yan sa population. If you are 65 years old and above, you are part of the elderly, alam naman natin mas mabilis ang waning protection sa mga bakuna. Kaya nandito yan sila sa kahanay sa priority population for the third dose or the booster.
No, yung below 60 and you got COVID, you have natural immunity and you got the full 2 doses. Gaano katagal yung immunity mo?
Yeah, all of the data is telling us that 6 to 8 months is the protection for the vaccines.
Talagang yun talaga. Doc,
Even with the infection, even with previous infections.
Yes.
Doc, I don't know if you have data on this, pero from what I heard, some countries have already done studies on this. Yung 6 to 8 months, gaano kalaki ang ibababa ng efficacy ng bakuna? I mean, do you go back to zero? Hindi naman, di ba? You still have a level of effectivity, but how much?
Yes. Kung titingnan natin yung Israeli data, no, when they during the surge of case June, July, okay, the Pfizer vaccine, the efficacy went down as low as 39%. Okay, and
in 6 months,
in the
after 6
Qatar,
months.
yeah, in the Qatar data, I think it went down also as low as 50%. No, so the data in Qatar, especially the Israeli data, was also the basis for some countries who are giving also the mRNA vaccine because of that, no? And most of the waning efficacy affected are the 60 years old and above. And there were also a lot of these cases that went into a more severe form, and that's the reason why they immediately embarked on a third dose for the 60 years old and above. And 2 to 3 weeks after the third dose, you look at the data, they were able to publish it. The number of cases among the 60 years old and above, including those who developed severe, drastically went down.
Okay. Doc, asking you to put on your San Lazaro Hospital hat naman. Kamusta po dyan sa hospital? And in the hospitals in general, how are you? Kasi last week, we were reporting downward trends, downward numbers, and a lot of hospitals were saying, we don't feel it here in the hospitals. Kamusta po ngayon?
Malaki ang impact, no, for the past 2 weeks. Talagang bumaba ang mga COVID cases natin, no? And that I think very important for us. Medyo tumaas lang ang ibang infectious diseases kagaya ng dengue, kagaya ng tuberculosis, no? Mga HIV patients, no, na natakot siguro na magpapatingin ng mga ng pandemic pa. And they are the ones now who are admitted in the hospital. Tuberculosis is one of those, no, na sa tingin ko hindi naman neglected, but because of the pandemic, nabawasan yung confidence nila to go to the mga dot center. So dito sila ngayon, na-hospital sila ngayon because of more severe form of tuberculosis. And of course, dengue, no? Medyo umakyat-akyat na yung dengue cases natin.
Okay.
Well, dahil mabagal na infections, there, of course, the economic team and businessmen, I think a lot of people are proposing the easing of restrictions, especially with Christmas approaching. Is there any area of concern there that you want to tell us?
The data will tell us na mababa na yung kaso, and I think we're pretty confident na if we open up at this point in time with these cases, most likely mukhang kaya naman, no? But again, we will always remind everyone, no? Especially in areas, in provinces na mas kulang-kulang pa yung mga bakuna nila, for them to really benefit with the vaccine and opening up the economy, it should be together.
Are you worried about the easing of restrictions on children, for example, younger children?
Well, we're already giving vaccines to the minors, no, 12 years old and above, and I think that's one step in terms of also protecting the children. But for the less than 12 years old, then that's I think the more concerning point now, because we don't have vaccines yet for these children. No? Most of these children only have mild to moderate symptoms, and in fact, some of them may not be symptomatic, but they're carrying the virus. The danger there is that in a household where there are unvaccinated, elderly, and vulnerable, then they can be able to transmit the infection.
Doc, balikan ko lang yung Israeli and Qatari study, which caused their governments to put in the third shots or the booster shots. But in these cases, you're talking about Pfizer vaccines, di ba?
Yeah, they're using both the mRNA vaccines. For Israel, it's Pfizer, and for Qatar, it's both Moderna and Pfizer.
Okay, well, I'd like to ask kasi about specifically Sinovac, kasi yun ang binigay sa ating mga health workers dito sa Pilipinas noong March 1 and going down. And I think most of the Filipinos have been getting Sinovac. So if I don't know, has that been factored in? How much yung pagbaba ng efficacy ng Sinovac 6 months going down?
Sa tingin ko medyo mataas-taas, no? Kasi ang breakthrough infections namin sa mga hospitals where I'm affiliated, medyo mataas ang mga nagka-infect na mga healthcare workers. And we also experienced that among our patients admitted. The 60 years old and above, fully vaccinated with Sinovac, still develop severe infection. No? So it's really more on that, the waning protection among this individual, plus the fact that they're vulnerable, highly exposed, and at the same time, immune system is not as good as that in the younger population. Then these are the population that we need to prioritize.
Doc, go ahead, Ami.
Yeah, pero yun na nga tinatanong nga ni Ed. Mas mababa daw ba yung
Yung Sinovac, yung pagbagsak. Kumbaga mas malaki po bang binagsak ng Sinovac efficacy after 6 to 8 months?
Kung bilangin natin, Ed, yung mga kaso sa breakthrough infection, mas marami ang nagka-breakthrough infection with Sinovac compared to other vaccines, but not compared to other vaccines, no? But the other vaccines also had breakthrough infections. Astra is one of that. And then there are also those who had Pfizer had breakthrough infections. Medyo marami lang ang Sinovac. On the data siguro, dahil mas maraming nabakunahan ng Sinovac, that I believe, no?
But so in terms of absolute numbers, mas malaki ang sa but as a proportion, more or less pare-pareho lang sila?
Hindi. Mataas talaga ang pagbaba sa
Mataas talaga.
Do we have any numbers, sir, from other countries, for example? Kasi for a while, kasi I think even the United Arab Emirates was vaccinating with Sinovac. So I don't know if there's any study along those lines.
Yes. And I think they now have shifted to the mRNA vaccines.
So kung ganon, do you have to give third dose or boosters for Sinovac earlier than 6 months? Ganun ba yan?
No, the current recommendation is still 6 months and above. So anytime 6 months and above, who receive fully vaccinated with Sinovac should receive third dose or booster.
Doc, speaking of data from Israel, last week I attended a forum organized by the Chamber of Commerce of Israel here in the Philippines and Makati Med Foundation. And one of the Israeli specialists was talking about, well, the effects of long COVID and basically even post-COVID care. Na-release na yung mga pasyente and yung iba pa nga mild na release. And then they're starting to monitor and really gather the data. And they're saying it's a real problem that maybe we haven't even begun to really look at in other countries. But are we seeing that here? Because sabi nila, ang laki ng implications. There are people, for example, going back to work, and they go back to work, and the workplace assumes na, wala naman daw nangyari sa iyo, released ka na nga eh. But now they're seeing the long-term effects even for mild patients. Are we starting to track that as well here in the Philippines?
Yes, Robbie, no, even during the first surge of cases last year, we already did some follow-up on this long COVID because we already experienced a lot of this long COVID. And in fact, we have data on that na talagang who are they? These are the 60 years old and above, those who develop moderate and severe critical that they're still develop symptoms as long as 3 to 6 months, no? In fact, we have patients like that needing oxygen 2 to 3 months after discharge. Some of them are readmitted to the hospital again because of pneumonia, and some of them lost appetite, weight loss. All of this we have on if other countries experience this, we also experience that here in our setting.
But they are no longer contagious, no? Yung people with long COVID.
Yes, hindi na sila contagious, kaya lang dapat na ang long-term effect talaga, no, especially ang effect nito sa puso, no, sa bato, no, and hindi lang kasi sa baga ang nagiging effect nito, no. So there are hospitals now who have this mga post-COVID clinic, no, to track and monitor these patients.
Yung isang point kasi nung Israelis, apart from looking at the data, is public policy, and for that matter, policy in the workplace keeping up with this. Kasi yung iba nga, tinatrato nga, sabi nila na, magaling ka na di ba? And so it's not keeping pace. In any case, unfortunately, maybe, Doc, we'll have you back, and then we can devote a longer discussion on this particular phenomenon of long COVID also, because there are a lot of people who have recovered and probably still struggling with this.
Yeah, I agree with that, no? Because we have to enhance the awareness of this long COVID. And in fact, may mga ang tawag nito, mga employer na talagang they're pressuring their yung mga employee nila na to go back to work. But most of them goes to the infectious disease specialist to get the certificate that they can't work for 2 months or for 3 months. And I think we need to address also this part of the COVID symptom.
Sige, we'll table that for another discussion, and asahan niyo po, imbitahan po namin kayo ulit. Huwag po kayo magsasawa, Dr. Ronjin Solante. Maraming salamat po.
Thank you, and stay safe.
Ingat, Doc.
Ingat po. That's all for this edition of The Chiefs. We hope it was discussed here. We'll keep the conversation going. Before we go, a reminder to our viewers, mask on, wash hands, and stay safe, Philippines. I'm Robbie Alampay.
I'm Ami Pamintuan of the Philippine Star.
I'm Ed Lingao, and we are One News.